Hello and welcome back to Dr. Carri's Clinical Corner. Today we're going to talk about overactive bladder. And so if you look at my previous videos, I talked about this in males specifically and how it's usually related to enlarged prostate and not a lot that pelvic floor therapy can do. Today we're going to talk a little more specifically about females. So what is overactive bladder? I think it's sort of like a loose term and not a real specific like medical term, but basically it means you're just going to the bathroom more often, or you feel like you always have to go to the bathroom. And so there are some medications for this, and some of my patients take it, but the side effect of the medication is usually constipation. And so it's sort of this cycle, right? And so in pelvic floor therapy, we're going to look at, are the muscles of the pelvic floor tight, or are they weak, or are they functioning just fine? And I kind of see all of those things, but I'll tell you most commonly, the pelvic floor muscles are just fine. And what that means is we got to work on your bladder habits. And so I have a whole online training program for that. I'll link below the free introductory course you can take a peek at. It has some tips to get started. But basically, for most people, and mostly women, okay, and this most commonly is like older women after menopause, but not always. I have young women too. And I think a lot of times it's poor habits and they just sort of catch up with you over time. And then I think for some of my older women, it's sort of like the hormonal changes affect the vaginal tissues, and that just gives you like less support. But let's talk real quick the other two scenarios, if it's muscle tightness or muscle weakness. So these, honestly, I don't see as commonly in the clinic, but it can be muscle tightness. So if this is your bladder, okay, this is a model of your bladder, and it sits in the bottom of the pelvis. So if your pelvic floor muscles are tight, they're basically always squeezing on this. And so if we can get them to be more relaxed, then the bladder is going to be able to fill up more, and it's not going to always feel that sensation like I need to go to the bathroom. And so sort of in the male side, the bladder sits higher and the prostate sits under it, and then the urethra through the penis and out. And so it's not directly in contact with the pelvic floor muscles. And so that's why in men, when the prostate enlarges, it's pressing on the bladder. It's giving the bladder less space to fill up, and it's pressing on it. So that's why in males, it's usually more due to prostate enlargement, and there's really like nothing we can do about that. But in females, because it sits next to the pelvic floor muscles, if the muscles are tight and we can get them to relax, then the bladder has more room to fill up. And also if something's always pressing on the bladder, it's always giving the sensation that it's time to go to the bathroom. So there's things we can do about that. On the other end of the spectrum is muscle weakness. So sometimes, this just doesn't happen that often. I'm trying to think of scenarios, but very rarely is overactive bladder due to muscle weakness. But potentially, like, if you feel like, oh, I'm gonna dribble, then maybe muscle weakness, but it's just really uncommon. I'm stumped. I stumped myself because it just doesn't really happen. But one other thing back to the tight muscles is normally when we go pee, so normally there's a sphincter that is automatic, and then there's pelvic floor muscles that we have control over. So normally when it's not time to go to the bathroom, the sphincter is closed, the pelvic floor muscles are closed around the bladder. And then when we go to the bathroom, the pelvic floor muscles relax, the sphincter relaxes, and we empty the urine, male and female. But another thing that can happen with tight pelvic floor muscles is sort of like that doesn't fully relax to open, and you don't completely empty the bladder, so then you feel like you need to go again because you didn't fully empty. So that's another thing that can happen with tight pelvic floor muscles. So for those people, one tip I give them is just wait an extra like 15 seconds after you pee to see if there's anything else to come out. But that's a problem with muscle tightness. Like I said, muscle weakness, I can't really think of any patients I've seen with that. It's pretty rare. But the most common thing I see with people who have overactive bladder in the clinic is when we test their pelvic floor muscles, they're fine. They're strong, they relax when they should, they turn on when they should, they turn off when they should. Often it's all within normal. So then people are like, then what? But that's why I created my online bladder program, because it's not something we need to physically do together, it's bladder habits. And so then you got to think about how often you're going to the bathroom, and there's a whole strategy to sort of delay that and spread that out and teach your body. So also what happens with overactive bladder is if you're going all the time, your bladder kind of shrinks. But this is a model, it's hard plastic, but really your bladder is like a water balloon. And so if things are pressing on it, it's not gonna like be able to hold that much. And then it's gonna adapt. Our bodies are very adaptable, and it's gonna be smaller. And so if we are going all the time, it's smaller. But if we change our habits and we increase the time between when we're going to the bathroom, and we sort of like dampen those signals, so what happens, a whole bunch of things happen, but we go to the bathroom too often, our bladder shrinks, our brain adapts to that, and we think we have to go to the bathroom every 30 minutes, 15 minutes, hour, whatever it is. But we can change those things, we can adapt them back to a better sort of timeline. And so what will happen is the bladder will be able to hold more, the muscles won't be pressing on it, and the signal will become more normalized. So normally you get a signal when it's about half full, you get sort of like that warning signal. And then when it's like 80% full, the bladder, then you get a strong signal like, I need to go, right? And so sometimes over time when you're going to the bathroom too much, those signals can get amplified and they can feel urgent. And then you go and it's like not that much urine or just a few drops. So we have to sort of like rewire the brain as well as fix the muscles and the bladder control. And yeah, like I said, a lot of that doesn't have anything to do with the pelvic floor muscles themselves. So yeah, I made a whole online course for that, and yeah, take the free introductory section of that to see and learn a few things. But it does get better. Like the patients I do see in the clinic, I usually just see them every few weeks. We check in, we work on more strategies, and then again, we see each other in a few more weeks. But that's really what it is. It's strategies that are going to make you better. So you can take the medication, but back to the medication. So the side effect of the medication for overactive bladder is constipation. And here's a model of your rectum and your bladder, and they sit right next to each other inside the pelvis. And so if we're constipated and our rectum is taking up more space, then again, that's pressing on the bladder and it's going to make you feel like you need to go. So for some people, the medication helps, but a lot of them, it's like, just kind of creates a different cycle, and they feel worse because they're constipated. So I have seen patients who are doing pelvic floor therapy or doing the online program and taking the medication, and then they sort of wean off the medication, because some people do need the combination of both, but I'm not a huge fan of the medication. Don't get me wrong, there's certain time and place for certain medications, but I think this one just is going to create other side effects that are just as unpleasant, that are also going to like feed into the original problem of overactive bladder. So I think if you need the medication, like take it for a time while you're doing the other stuff, and then I would try to wean off. Me personally, that's what I would do. But it's you and your body. You choose what you want to do. So yeah, that's overactive bladder. And again, this is more for females, because males, it's more usually related to the enlarged prostate. So males can try the strategies. I think it helps somewhat. But there's anatomical changes in males that are making it, whereas females, often there's not anatomical changes, it's just habit. All right, I will link the free bladder class below, so sign up for that, check it out, implement some of the strategies in there, and then see if you want to do the full course.